Hi, it's Chris Moore with Senior Remodeling Experts. Welcome to Aging in Place is a Team Sport. It's a video series where we talk to different providers. We explore how families, professionals, and communities can come together to help older adults live safely, comfortably, and independently at home. I'm here to guide you, connect you with the right resources, and help make the rest of your life the best of your life. Welcome back to Aging in Place is a Team Sport. I'm Chris Moore with Senior Remodeling Experts, and we are fortunate to have another episode, another conversation with one of the team players on the Aging in Place team. So today I am delighted to have with me Wendy Adlerstein. So happy to have you, Wendy. Tell me about what you do in the Aging in Place world.
Sure. Thank you so much for having me on. I am a social worker by background. I've been in the aging field for a few decades now, helping in many different ways over the years, mostly helping people age where they would like to in place. And currently I am the co-owner and executive director of a private home care agency right outside the Boston area called FirstLight Home Care of West Suburban Boston. We are a franchise. There are FirstLight Home Care offices all across the country. Each office is privately owned. And what we do is provide care in the homes to people wherever home is to help with anything that will assist somebody to remain safely in place.
Okay. Wendy, for those people who may not understand the difference, explain what home care is, maybe as contrasted with home health care or other services that might come into the home and provide different services. Exactly what level of service do you provide in your organization?
Yeah. Now that's a really great question. So home health care, as it's termed usually, is typically including something called skilled care, which would be a nurse, physical therapy, occupational therapy. And a lot of times people will be able to be eligible for this type of care in the home after a few days in a hospital stay or at a rehab. They go home and they can qualify for home health care in that type of way under Medicare. We, as an agency, are what's called a non-medical home care agency. And as I mentioned, we happen to be private pay and also accept long-term care insurance. And what we provide are more of we call them not non-skilled services. However, we do have on staff home health aides and certified nursing assistants who are trained to assist with things like bathing, dressing, help, in the bathroom in general, bed care, and can also do things around the house like meal prep, changing bed linens, doing laundry, tidying up, light house cleaning, that kind of thing. Companionship, which is also, a piece of it all. Taking somebody out, maybe driving them to a medical appointment or going out for an errand or even a social activity. So that's the latter that I described is what we do, and home health typically would be a service through a different type of agency that has those more skilled needs covered. So
my first thought when you answered that question is, how dare somebody say what you do is not skilled? Because, those are definite skills, companionship and taking care of someone and, changing beds and cooking meals and running errands. Those are all skills. And it reminds me of when my son was playing football and he was a lineman, and they did the same thing in football. They called the quarterback and the running backs the skill players, and the linemen were just, big bodies to, bump against the other big bodies. And that was, how we define terms sometimes in our society really illustrates sometimes where our values are askew. And I think even that terminology suggests that there's something less valuable about serving someone with their basic needs on a basic level than there is, more medical or more specialized kinds of services. But because I think that what you do for somebody who needs the services that you provide, they're absolutely skills. They're absolutely things that they need to thrive and to be comfortable and safe in the environment that they choose to live in.
Yeah. Well, you brought up an excellent point, and I agree 100% with you that the terminology that's thrown around in this aging space that we're working within, it is not aligning with what is more appropriate to, what we should be saying, which I agree with you, because of course the skills and the care that we're providing are skilled. People who go into these homes and do this very challenging work, it takes skill, especially some of the work they're doing around dementia care, working with some very challenging scenarios, helping manage people's behaviors that come up, spending time with somebody who's forgetful, really just making a difference in people's lives in so many ways takes a lot of skill. So I 100% agree with you. It is not a good terminology to be using, but that is how it's referred to, unfortunately.
Right. Well,
Services.
one of the big things for me is to help people to retain their autonomy as long as possible. And I think a lot of things about the model that we currently have on so many levels is that people reach a certain point, whether you define that by age, you define that by capacity, you define that by cognitive ability. And then at that point, you other people are making your decisions for you. And one of the things that I did a book signing last night, and one of the conversations that came up was that for people who plan ahead, for people that kind of have already anticipated that maybe I might have certain needs as I age, and to have those conversations ahead of time and to develop relationships with providers when you don't need the services at the moment, but you've already had the conversation. You've already identified people that you know, like, and trust. And so you have that information in your back pocket. And so you can make a phone call if and when that happens. And I compare this with car insurance. Everybody carries car insurance. I've never heard anybody at the end of their policy year say, daggone it, I didn't have a accident, and so I wasted my car insurance this year. Nobody thinks that way. But somehow, when it comes to aging in place and our needs to stay in our home, people don't want to have a conversation. They don't want to talk about it. And a lot of times, it's only after there's been a traumatic event, after there's been a diagnosis, after there's been some material change in circumstance, that people suddenly start looking for solutions. What percentage of your new clients, what percentage of your phone calls of people that call wanting to know about your services are in the, oh my goodness, something's happened and now we've got to scramble and get some help?
Mm.
Would you say off the top of your head?
I think it's easily 90% or more of the calls that we get are people in the moment, scrambling around, trying to figure out next steps, what to do, what services are out there, how does this all work? Lots of questions around that. And people are definitely coming to the table with these questions in the moment. One of the things that we always try to get the word out about is like what you're saying is planning is everything. Start the conversations early with your family members to learn what they would want in a situation that could become, that could occur, and do homework ahead of time. Reach out, to different agencies, learn about them ahead of time when there's not much going on, develop a connection, a relationship with an agency, do some touring of assisted livings, see what's out there, learn the services way ahead and start having those conversations early, because it is harder to make decisions in a crisis. And of course, makes it more challenging. It's already so stressful when you have a loved one in an acute situation, unexpected, it's emotional already. So it's good to
Yeah.
try to get ahead of it. Yeah.
Yeah. So do you find that most of your calls come from an adult child, from a spouse, from another family member, or does it vary?
Yeah, the majority of the calls do come from adult children, and nieces and nephews, some spouses for sure, but I would say most are adult children. Some living far away from their parents or loved one, in another state, and they're managing things from afar. And some people, are nearby and are still. It's just they're still managing a lot of stress,
Right.
caregiving. Yeah.
Yeah, 100%. So do you find that the home environment a lot of times can be challenging the way houses are built? Because obviously I'm a contractor and a lot of my business is going in and making homes easier and safer and more accessible. And a lot of that work benefits the caregiver as much or more than it benefits the client, because the statistics about caregivers who are lifting and carrying and very, very difficult physical moving of patients who have severe mobility challenges can be a big risk. And how do you deal with that in your day to day life of your workers?
So it's true. Accessibility in a home can really make or break how care is given. A lot of the houses in our area, right outside, in the Boston area, Massachusetts, are older homes. And many of them actually don't even have a first floor full bathroom. And right there, we see a lot of challenges. If somebody can't get up and down the steps to get up to the bathroom, uh, you know, they're kind of in a situation where they can't take a shower easily. And so that's one thing we see a lot of. Steps in general can be a problem. We see a lot of people getting the stair lifts put in to go up and down, in a chair, which certainly make a difference. Or our caregivers are trained to, walk with people safely up and down the steps to mitigate a fall. Bathrooms, of course, should be outfitted appropriately to provide the safety measures that it takes to avoid falls and slips and everything else. So there's a lot of looking at that when going into the home and seeing what does a bathroom look like, and are the appropriate things set up. So yes, it's the environment makes a difference, and we're always looking at that.
Yeah.
Yeah.
So do you have local providers in your area that you can refer people to if they are in the market for some home modifications, maybe a stair lift, some grab bars or doorways?
Yeah. It's all part of the team.
Okay.
Always working together, yeah, to refer families to the appropriate services. And of course, one of them is absolutely the home modifications and all that comes with it. Yeah.
And do you provide transportation as well, if that's something that people?
We do. Our caregivers are fully vetted in many ways. And one of the ways that they're vetted is looking at their driving record backgrounds and, making sure that everything is in compliance for driving. So if they do fit into the category of passing, the driving standards, then we do allow them to drive our clients to places wherever they'd like to go.
And how big of an area you say you're you say you're north of Boston, is that correct?
We're actually a little bit west.
Okay.
Yeah,
And do you cover
slightly.
the do you cover the entire metro area, or what area do you cover?
We're in, well, we call it the West Suburban Boston area. So we have a territory about 15 minutes outside the city that goes, west and then a little bit slightly north and a little bit south. There's other FirstLight offices in Massachusetts. So they have different areas that they cover as well. And, we're all independently owned, but certainly, with all high standards of care that we provide.
Yeah.
Yeah.
What would you say the biggest misconception that people have about home care and what it involves and how it helps, and for somebody that's never had any experience, never thought about it, are there things that people come back to you and are surprised or just didn't understand about your services?
One of the things I think people tend to be surprised about is that Medicare does not cover this type of service. And an unfortunate, piece that our services are meant to really, be ongoing and sort of provide that daily support that people need. And that can include overnight care, where somebody's getting up throughout the night quite frequently and needs somebody right there with them so that they don't fall, or that they may need to be directed, into the right place to go to the bathroom, things like that. Or it can be during the day, just the daily activities of getting up, getting dressed, getting, cleaned up, breakfast, medication reminders, all the things that just help function throughout the day. And right now, Medicare does not cover this type of ongoing service for long periods of time during the day and night. So I think a lot of people are surprised when they hear that. So that's one thing that I hear quite a bit. And then once we get started into things, it's really an educational process as we go along. Some people we start very small with short, 4 hours a day, something like that. Get people used to the fact that somebody's coming into the house. It's a whole new experience, and really helping them to bond with the caregiver so that there's a relationship that builds. And then from there, people tend to really see how it can make a difference. And as person may age or needs change, we can change the schedule. We can add, we can take away, but it's a very fluid process. And I think people are also often glad to hear that, because it's not something that has to be set in stone, or, that's set up and that's the way it has to be. It's very fluid. So
Right.
people move along with that.
Yeah, I think that for a lot of people, the admission that they need help with something can be very emotionally difficult, because there's a certain amount of self-determination and, what's the word? I guess autonomy, or just making your own decisions and taking care of yourself. And it's very difficult to say, I need help with this area. And in my work, I see a lot of people that are in denial and will go to great lengths to keep anybody from knowing that they need help. And oftentimes a family member will start to, put the pieces together and start having the conversation with them. I had a conversation at my book signing last night with a woman that had a mother who was having trouble stepping in and out of the bathtub. And she was talking to her about taking the tub out and putting in a shower. And her mother didn't want to talk about it. She didn't want anything to do with it. She didn't want people, that she didn't know in her house. And it apparently turned into a matter of, some contention between the two of them over, what the right course of action was, to take. And I think grown children oftentimes are concerned about, safety. They're concerned about the well-being of their parent, but sometimes in their zeal to help, they make things worse because they make the parent feel like they're not in charge of their life anymore. And so I have found it to be a very, very difficult tightrope to walk sometimes as we have these conversations and we interact with people, and we're trying to provide services, but the family dynamics are such that there's a lot of conflict going on, and maybe there's multiple, grown children, and they all have different agendas. And, you're there in the middle kind of trying to put together something that will serve and bring some help to the situation, but also kind of not exacerbate the family dynamics.
Yeah, it is. It's a very tricky line to walk. I often find that including the individual in the conversation, if you can get them in the room with the adult children or child, to have them feel included, to allow them to be part of the conversation, the decision making, asking questions, hearing about the topic that, we're trying to bring to them, whether it's home care or, uh, making a change in the bathtub, if they can feel as involved as possible, that seems to also help in the conversation. Finding the sort of the piece that's going to resonate the most with the individual. So, for example, recently we had a new person that, the family felt that the woman, their mom, really needed the care. Um, the woman, the mom, really did not feel that she needed anyone in the house, that she was fine and independent, and she was going to keep going the way she was. But in talking in the conversation, we started to talk about cooking and food, meals, and how was she doing the meals, and did she really enjoy still cooking for herself? And she was sort of showing that it was a little bit tiring for her, a little bit of a chore, that she really didn't enjoy anymore cooking. So we were able to turn it into thinking about having somebody come in just for meals.
Mm.
And with that, it got us in, and it was a way for us to at least introduce a caregiver who now was there for the meals, but it's another set of eyes. And once the relationship gets established, then we start to see, okay, now she knows this person. Maybe they can start to help a little more with showers, or maybe they can help with, some of the other things around the house that are needed. So it's finding out a little bit of where you can connect with that person who's resisting and maybe try to work with it from that angle.
You have to be a little bit of a counselor and a little bit of a psychologist and
Yeah, a little bit of a sleuth. Yeah.
yeah, 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 100%.
Yeah.
And I think that because when it becomes a relationship, when it becomes somebody they know, and they especially if they hit it off well, and they enjoy each other's company, then asking for things becomes a lot easier, right? Because it's somebody that you have a relationship with there already. Yeah.
One of the things I've seen over the years is a lot of it is the fear of the unknown and not really being able to fathom that someone is going to come into the house, because who is that someone, I think, is the big question. And it changes things when they can actually meet the person and, like you said, establish a relationship, a connection, that then it becomes easier to really, I think, wrap their head around the fact that, okay, now I see who this person is. She's very nice, or he's very nice. They're going to come in. I could see that maybe they could be helpful now that I understand who they are, their personality, and it can go from there. So sometimes that's another approach that we take, is actually just offering an introduction with a person who might come in and see how that goes.
Yeah. So how do you go about vetting your caregivers? What does the process look like for somebody who, is coming to work for you as a caregiver, to make sure that um that you can assure the client that, these people are trustworthy?
So for us, all of our caregivers are employees. They're not contracted. So they go through multi-state background checks, Massachusetts SCORY checks, reference checks, interviews. We measure their judgment in different situations through taking some tests and quizzes. And so there's a lot of checkpoints that they have to go through with us. And then once they meet our very high standards and they become employees, they're actually under our umbrella of all our insurances, our supervision, our coordination of care. So the family really gets a whole package with having us in the mix as part of their care team, to be able to really ensure that we're bringing in really quality people. We do a lot of oversight as well in the home, to make sure things are going well. But these caregivers are heavily vetted for us.
Yeah. And I'm sure you communicate that to your clients, and, to help put them at ease. You mentioned earlier about funding and people being surprised that Medicare doesn't pay for your services. And I run into a lot of that too when I talk about home modifications, and people want to know, does Medicare pay for it? Are there funding sources? And in my state, there are some. There's a tax credit, and there are some grants, and there are some things that can help in certain circumstances. But of course, you have to jump through certain hoops and apply for, like all of those kinds of programs. There's just some barrier to entry. But would you say that most, I mean, obviously most of your clients are private pay, if not all. Is there I guess, what socioeconomic strata are most of your customers in? Because to me, there's always, in many of these areas, there's always been a void kind of in the middle. People that obviously are very wealthy can afford to pay for things. People that are very low income often qualify for benefits in different areas, not just talking about home care, but just in general, qualify for benefits. But then there seems to be a larger and larger segment in the middle where people really don't have the funds to pay for things out of pocket, but they also don't qualify for benefits. And I think that's a conversation that a lot of people are having in terms of what should the model look like. And with the growing number of seniors, or what I like to call experienced adults in our society, the need for all of these services are just going to continue to grow. And people who are, in the public policy arena talking about, how are we going to take care of these people, don't like the paradigm that we consider our older adults to be a burden to society. I think they have great wisdom that we can glean, and we're in so many ways missing out on. But that being said, clearly this society is getting older. Clearly, over the next several decades, there's going to be an increasing need for the kinds of services that you and I provide. And was wondering if you have conversations, do you have, in your networking, are there conversations about, what that's going to look like, or projections over the next 10, 20 years? Are we going to be able to keep up, or are we going to need a different model? Well, I'll save that question for next one. We'll answer that right now. Is this something that you are looking at, that you're projecting and you're thinking about as you look towards the future?
It's definitely an issue. Everything that you described is really reality. Yes, our services are private pay, and for people who do have the long-term care insurance policies that maybe they purchased many years ago, and they've been paying those premiums all these years, and now they're starting to activate the policies and use those benefits. But certainly not everybody has a long-term care policy. And it's true that, private pay care and other services that are needed in order to age in place are not cheap. It is a growing concern. And there, like you said, there are some programs that are out there in our area as well for some level of service through state funding and some federal funding. But, it's not at the level yet of providing, probably as much care as some people need. It provides in limited amounts. And that is actually part of my background. I used to work for many years in an agency that provided these services for people, and they do exist. We're starting to see some small bits of Medicare funded programs coming out around some dementia care. There's a new program called the Guide program, which is just starting to get more popular, and it does provide for people who have some form of dementia can apply and get some finite amount of money towards care, which is a start. To start to see some of this money coming out to pay for that is good. But I think, as there's just more to go. And there is a need for it. And as you said, there's a growing population of aging people who are living very long. People are living longer and longer, having more and more needs. And so hopefully we'll see more as time goes on.
Yeah. I wanted to ask you about leveraging technology, and specifically about activity monitoring systems, electronic monitoring. I would imagine that you have clients who their family has determined that it's really not safe for them to be alone. And you may have clients with 24-hour care. But I would say that probably a large portion of that 24 hours, they're on standby, if you will, because, the client's asleep, or they're sitting in their chair and they're there in case something happens. But I know that there's been a lot of advances in technology, and systems exist that in certain circumstances could potentially run in the background and alert a caregiver who was nearby, who is on standby, who could get there very quickly, but would not necessarily need to be sitting there on the clock for 24 hours a day if that technology was functioning properly. And I know there's a lot of talk in the caregiving industry about this kind of thing and getting more and using that to leverage the man hours that you have available. And I'm wondering if that's something that you have explored, that you are using, or that you can talk about, where that is in the industry right now.
Yeah, we're not seeing it quite yet or using it in our practice, but I have heard about many of these types of technology that it's like you said, a monitor that can be in the home and they come in different functions. I've heard of one where it will track the person throughout the house to kind of monitor even the frequency of how often they're going to the bathroom. And then maybe it will predict if the person's maybe at risk for a UTI.
Right.
I've heard of if someone doesn't respond or, if someone falls, clearly it would alert whoever is on the list to be alerted to that somebody fell. So it's sort of a bigger step away from the original, buttons that people have worn traditionally where they wear it around their neck or their wrist. Well, now you can just place things in the house and it will track you. So those things I've been hearing more about. There's, I think that people are probably need to get used to it. It's hard to sell it to the person living in the house because I think not only is technology sometimes new to somebody who's maybe in their later years of life, but also they're not always open to the idea of having something track them and follow them around the house. So it may become more popular as things go along, but we're not seeing a lot of it in where we are. I don't know if you've been seeing more of it being used, but I do hear about these things.
Yeah. Well, there are definitely privacy concerns. And
Yeah.
I have seen a number of these systems kind of come and go. I have not seen anything really um, catch on and gain footing. And whether that's because um, the technology has not advanced to the point where it's 100% reliable, or whether it's because there is resistance in the marketplace to the whole idea. I'm not sure, but certainly the voice activated Alexa type systems have become very popular. Not necessarily for what we're talking about, but just in home automation and setting your home up to at certain triggers, adjusting the lights and the temperature and the music and all those kinds of things. Certainly. So I think it's coming. Like you, I don't think it's caught on yet. I mean, I've read about a number of different wearable fall detection systems that are supposed to notify if there's a fall. I think the Apple Watch is supposed to do that, but I've read mixed reviews about how reliable they are, how if you just sit down quickly, it could trigger a false alert. So yeah, there are definitely some concerns and some questions and some caveats, but I think the potential for leveraging the number of caregivers we have, I think is huge. And I think, just the sheer need over the coming years will drive innovation. Somebody's going to come up with something that I think works well.
Yeah.
And exactly what form that takes, it's hard to predict, but I did have one client who we installed a system for, and she lived alone and she was out in the backyard and she fell and she was unable to get up. And fortunately, her lawn care company found her. They stopped by to see if the lawn needed to be mowed and found her and got her the medical care that she needed, which was very fortunate because there was a severe storm that night
Wow.
and she probably would not have survived. But her daughter lived 3 hours away, and she was very, very leery about letting her mother go back to living alone. And we installed this system that was able to monitor when she got up and when she went to bed and some basic movements. There were no cameras involved, but it was some basic movements and when I asked him about it later, she said the only problem she had with it, she didn't like her daughter knowing what time she got out of bed in the morning because that was none of her business.
That's funny.
Yeah. But yeah, she had that system for, for several years, and it gave her daughter some peace of mind. And, it would and the one that I've heard a lot about is the stove monitor,
Hmm.
where you can put a monitor on the stove and it's in conjunction with a motion sensor. And what it'll do is if the stove is on, but there's no movement in the kitchen for a certain period of time, it can either notify somebody or it can just turn the stove off. And I think, safety is like preventing house fires. I think that's a great, fairly simple application, but that could, save somebody's life.
Absolutely. That's a
Yeah.
great one. Yeah.
Yeah.
Yeah. I've seen even the use of the Alexa where it has the video camera on it, not just the listening version, and how, families can actually drop in with the video camera and visit with their loved one, or just check in on them by, if they needed to. But it can relieve isolation and, provide some visit time with families and socialization just by having that, which is, something right there that alleviates that piece of loneliness or even
Right.
just family time. Yeah.
Right. Right. And I saw one that was, really simple. It was basically just an automated text message. And, every day at a certain time, there was a text and the person just responded back with a Y or whatever the prearranged signal was that said, yeah, everything's fine. And if they don't, then it calls somebody and says, you might want to
Yeah.
check and make sure. Or I've heard of people having a system with their neighbors that, they open the blinds when they get up in the morning.
Yeah.
And so the neighbor looks over and sees the blinds are open and, but if
Yeah.
they look over one morning at, and it's 1 o'clock in the afternoon and the blinds aren't open, then, that's a signal to maybe go see if everything's okay.
Yeah.
So, it doesn't have to be high tech,
Right. Right.
right? But just and having those connections, having those social connections with friends or family or somebody that cares about you and will check on you and check on your well-being, I think is one of the things that um in many cases people have become more isolated. There's less of a community connection in a lot of places where people used to be more tight knit, and you had neighbors and family was closer. People didn't tend to be as spread out across the country as they are now, and so I think a lot of the what your company does is all things that traditionally extended family did,
Yeah.
and sometimes they still do, but like you said, you have clients and their families all out of town,
Yep.
right?
Yep. Yeah. And I a lot of the caregivers that we hire come from other countries where that is the way. They're still living in areas where the family is together, caring for each other, caring for their elders. So it's ingrained in some of the people doing this work when they're here working with us that they treat the people with that like family.
Yeah,
Because that's how they know things to be.
right.
The heart is there, the care is there. Yeah.
Well, that's great, Wendy. I really have enjoyed our conversation. I think we are almost out of time here. Any last thoughts or things that maybe people listening would benefit from? Let's say they're not in your area, but they feel like maybe they have a need for services such as you are providing. How would you suggest that people begin the process of finding a home care company in their area that they can trust, that, is reliable? What steps would you recommend they go through to make a decision if there are multiple ones in their local area?
I would say, do your homework. Start with maybe looking online, reading online reviews. Once you call an agency, ask them the questions. How do they vet their caregivers? Are their caregivers employees? And do they have what is their mechanism for supervision and oversight and communication with the family? Do they carry insurances, and workers' comp insurance and things that will protect, not only the caregivers, but also the people who are having these people in their homes? Maybe ask for a reference, maybe ask if they're willing to provide the name of a couple of clients who have used their services so that you can call those people and ask about their experience and how the agency responded to things, how things were done. And, call a couple of, do your comparisons. Sometimes calling different ones, when you speak to the person on the other end of the line, you feel it when you hear, what are the reasons they do this work and how do they operate? And, with all the research that you're doing, hopefully you can really vet out the best agency that works for your needs and do it early. As we were saying, don't wait till the last minute. Plan, try to get relationships established ahead of time just to know who the go-to people are for you in your area. And, I think you'll be in a much better place if you do it that way.
Yeah, great. Good ideas. So, Wendy, for people that are listening to this that might be in your area and could use your services or know somebody who could, how can they get in touch with you?
Well, we can be found by calling us 781-559-0220 or look at our website, FirstLight Home Care of West Suburban Boston. You can just Google that and you will find our page, and we're happy to answer any questions. So thank you for the opportunity to talk with you.
Yeah. Well, thank you for being here, Wendy. And you given me a lot of good answers. And I'm sure that these um, discussions will be helpful to people that are listening. And so I thank you for coming on. And for all of you listening or watching, aging in place is a team sport. I encourage you to start early, to plan for your needs, to talk to providers in your area, find out who those that are trustworthy and provide good levels of service. And as always, thank you for listening. If this has been helpful to you, please let me know. Please give me ideas about future guests you'd like to see on Aging in Place is a Team Sport. See you next time.